This is like having the best chief resident kind of working for you and getting all the information from the patient before passing it up to you as the doctor to treat.
Today, we're sitting down with the minds behind Doctronic, an AI-based healthcare platform that offers instant consultations and affordable video visits with licensed doctors. We are here today with Matt Pavelle and Adam Oskowitz, founder of Doctronic. Matt, Adam, thanks for being here.
Thanks for having us.
Thanks, Will.
I want to jump into it because I think what you built is so interesting. We've heard the pitfalls of Dr. Google and WebMD, but what you're building is distinctly different from that. So what was the challenge like of building a platform that people felt safe and comfortable putting sensitive health information into, but is not going to fall into the pitfalls of earlier iterations of those kind of products?
Doctronic is totally anonymous by default, and I think that solves a lot of the issues here, right? So when you go to use the platform, it's only going to ask you your age and your sex and nothing more. And everything is fully encrypted and everything is HIPAA-secured. And so the entire process is, if you want, completely anonymous. And your entire discussion with the AI and your entire chat can just be lost into the ether when you're done, if you want. You can make an account to save it if that's something that you want to do, but you don't have to. So privacy is kind of the guiding principle here.
I think when we were building this, we realized that healthcare and people's health are just fundamentally personal, and it's really important to build trust. And to do that, we had to make it secure, and the easiest way to do that was to make it anonymous. So you can come use the platform anytime you want. You can never tell us anything about you. It's always free.
So Matt, you're a serial entrepreneur. Adam, a doctor. It sounds like a bad joke. These two guys walk into a bar, start an AI-powered healthcare platform.
Yeah.
Tell me about the genesis of Doctronic. Where did this kind of begin from? What were the early conceptualizations of the product?
Yeah, so I'm an entrepreneur. I've been building tech companies for 25 years, but my wife is a doctor, my mother-in-law is a doctor, I have a bunch of cousins that are doctors, a lot of family members that are doctors. All my friends, though, they work in tech. They work for Google or Apple or Microsoft. So they've all got great health insurance, right? And I found that they were all calling me to talk to my wife and ask her medical questions often, right, whenever something came up, because the healthcare system was kind of failing them in general. And I thought, well, listen, if the people with the best health insurance in the country are calling to talk to my wife because they have medical questions, what's it like for everyone else, right? And so Adam and I kind of started talking about this.
When you have a healthcare problem, what's the first challenge you have, right? And it's always access. It's always, how do I reach out and touch the healthcare system? It's always difficult. And so we started with that problem. We said, how do we improve access? And that is actually our guiding light for everything we build, right? We're very patient-focused. We want to solve for problems that patients have. And for us, the only problem that people really have is getting access to the system.
So before we dive much deeper, tell me kind of step by step, what does it look like for someone who wants to go in and access Doctronic, and who is this program really built for?
Yeah, so it's built for anyone, right? The Doctronic runs on a website, right? It's doctronic.ai. You can just do a Google search for AI doctor. It's the #1 result. You can just go in there and start a conversation. And like I said before, it's only going to ask what your age and your sex is, just to kind of get that little bit of personal information, and that's it. And then you're going to have a conversation with the AI discussing your health. Those conversations actually normally take a good 15 to 20 minutes with this like complex back and forth of this medical AI that we've built, kind of trying to figure out what's going on. And at the end of this conversation, what it's going to do is it's going to say, there are 4 potential problems that you're facing, and here are 4 potential solutions. And now here's the information for you to go take to your doctor, or our doctor, or any doctor, we don't care, in order to get treatment. But if you want, you can talk to one of our doctors, then and there. About 30 minutes is the wait time. It's 24 hours a day, 7 days a week, and actually get treated. So the process is really built for anybody that doesn't have time to wait, right, to see a doctor. And in New York, I think it's a 3-week wait time to see a primary care physician, which is nuts, right? I don't want to wait 3 minutes for the subway. I'm not going to wait 3 weeks to see a doctor, So we're trying to fix that problem and get people immediate access to healthcare.
Yeah. I always ask people, what does it look like when there's just no restrictions to gaining access to healthcare? You can start asking questions that you would never ask before because it takes 3 weeks to see a doctor. Well, now it takes 3 seconds, right? By breaking down those walls, we make it just very easy for you to engage with the system, ask it questions. You can leave, you can come back. You have a question that pops up 15 minutes later or 5 days later, you can always come back and ask follow-up questions.
It's interesting, and I could also see if you have something that maybe you're not even comfortable sharing in person to a doctor, you can put that question in because the computer's not going to judge you.
Thinking back to when we first started this, the first question we had was really, will people engage with an AI for their personal health information? At that time, there was a lot of concern about that. And when we launched, the first thing we realized is it's a resounding yes. There are a lot of things out there that people feel uncomfortable talking to their doctor about, right? And it doesn't necessarily need to be something that you would think would be uncomfortable. It can be something that is actually normal to talk about, right? But you just don't feel as comfortable talking to a doctor about it as you might with a private AI system.
How does this fit in with the larger ecosystem of the health system? Because it's not really meant to stand alone and be the end all be all. This isn't
Correct.
like the finish line, right?
Yeah. This is a platform where people can start to get that information and then optimize their communication with their doctors.
Empowering patients, we're not trying to replace doctors. This is supposed to be complementary, right? There's a lot of healthcare that you would want outside of the doctor's office, right? You want to be able to communicate better with your doctor. You want to learn about your symptoms. You want to learn about a disease you have. All of those things can be done with Doctronic, but it's got to be interconnected with the actual healthcare system that can give you prescriptions, order lab tests, get you to specialists, right? And so one of the key things is it's not just a standalone system away from the healthcare system. It's fully integrated with it, but like you said, it's not separated from it.
This is a theme that has come up in a lot of our interviews where the idea of AI is going to replace X, Y, and Z. But what you're saying is a lot of very similar to what we hear from a lot of other interviewees, which is it's not replacing, but it's augmenting, and it's taking maybe the heavy lifting or the dirty work out of these older systems that are inundated.
Healthcare has always had this fundamental math problem out there, which is supply never meets demand, right? There's just way too much that people want from the healthcare system, and healthcare providers can never actually meet that need. You don't need to replace healthcare providers with a system out there. You can actually just fill that void.
This is like having the best chief resident kind of working for you and getting all the information from the patient before passing it up to you as the doctor to treat, right? And that's what we're doing, right? We're not replacing doctors at all. We're just helping gather all that information and synthesize it. And again, it's fully anonymous if you need it to be, right? But if you make an account with us, and then we have an EHR, an electronic health records database that you can start to fill in and learn more and more about you, and then it just gets much more efficient at kind of helping you build this profile and pass that to your doctor and help your doctor understand your health better.
And that's quite important, right? We all have had circumstances where we go to a doctor and we walk in and the doctor says, tell me what I can do to help you. And the answer is, well, didn't you read my chart? Don't you know what is wrong with me? The reason that happens is oftentimes doctors are really busy. They don't have time to spend 30 or 40 minutes on everybody's chart. Well, Doctronic can. It can learn everything about you, and it can synthesize that information. And so when you come back, it can say things like, I noticed that you also had a headache 2 weeks ago. Is this similar to that headache, right? And that's where the real power of a system like this comes in.
Our memory, it's totally private, right? It never gets shared with any of the AI providers or anything. We have our own AI, we have our own memory, and obviously, if you want it to be deleted, it's gone forever, right? So you don't have to worry about your data getting out into the public anywhere. It's all HIPAA-secured and safe and encrypted.
I'm admittedly no AI expert, but can you kind of peel back the curtain a little bit and tell me about where did this model come from? How did you build it? And I'm specifically interested in kind of the oversight. If the AI is a little wrong, it's okay.
Yeah.
If the AI is really wrong, it could be catastrophic.
We're using multiple AI models, and we've built our own medical AI, and it does a couple of really interesting things. The individual AIs will kind of debate and talk with each other and come to consensus, which helps deal with hallucinations that are commonplace in a lot of AIs, right? And then also our AIs have their own proprietary data. It's just ours. We've built all of this ourselves. It's not data that exists in these base kind of fundamental generalized AIs. So it's really trained on this medical process. And so when we kind of combine those two pieces, we get this really interesting result, which is a lot of accuracy and low hallucinations. And we get to keep all of that within our system.
Our system is really a proprietary multi-agent system, right? So it's not a single base model that's trying to help you. It's a complex set of agents that all interact all have specific tasks within the medical workflow, right? And by combining all of those agents together, you just get a much more personalized experience, a much more accurate experience, and it allows us to just build faster and tailor it specifically to your needs.
And we have medical oversight, from doctors at every step of the process, right? Yeah. And so one of the things that we like to say is there are a lot of companies out there that are raising the ceiling for healthcare. They're trying to make healthcare for people who already have great healthcare even better, and that's great, nothing wrong with that. But we're trying to raise the floor of healthcare, right? We're trying to make it so that everybody has access to this sort of medical systems as if their doctors were UCSF or Mount Sinai or Cornell, Columbia trained doctors.
Can you tell me more about specifically the doctors involved in it, whether it was the building of the AI, in the oversight?
Yes, definitely built by doctors. The practice of medicine is grounded in clinical guidelines, right? We don't make things up. We actually follow a methodical approach. And there's lots of clinical guidelines out there. And if you can follow those clinical guidelines, you can actually deliver incredibly high quality healthcare, right? And so what we do is we take those guidelines that are out there and we instill them into our system. And so the system is designed to actually follow those guidelines to a T, which is what makes it something that, like we said, will raise the floor of healthcare, right? So everybody can get really high quality care because the system is designed to follow those guidelines.
And what do those internal deliberations look like? And how does that lead you to, I think you guys said there's a very high percent of the time is it gives you the first answer it spits out is the proper diagnosis.
To take a step back, we don't decide what's right or wrong, right? Like we don't make a decision, okay, this is the way we should treat this or this is the way we treat this. We rely on experts in that very specific field that actually put out those guidelines, right? So just to give you an example, we use this example because it's the most common disease out there, hypertension, right? There are dozens of guidelines out there on how to treat hypertension. When you're treating a patient, you actually can just follow those guidelines very, very classically, right? And you will deliver high quality care. And so that's how we make our decisions. We go to those expert papers that are out there. We distill them down for the AI.
But then we do have those doctors in the loop at the end of the conversation, right? And so we do know definitively what our accuracy levels are because the doctors are looking at what the AI has said and then they're actually talking to the patients, right? It's never just the AI. Those doctors get on a video call, they talk to the patient, they discuss it, they make sure everything is correct, and then they'll treat. And so we have a very high level of accuracy, right? And we're seeing 50,000 patients a week at this point, 10 million some odd chats already, and people keep coming back because we're delivering something that is meaningful and correct care.
Interesting. And what is do you have numbers on, for example, is it X% is the first guess is correct?
What we can share with you is that we see when a user actually goes to see one of our doctors, that about 70% of the time, the diagnosis and treatment plan exactly match, right? And by exactly match, I mean like same exact thing, right? There is a percentage of times where they're a little bit different, but it's actually probably exactly the same thing. It's just not an exact match because medicine is complex, right? And so you may call one thing by one name and it's actually the same thing as another name, right? We don't want to say that that's an exact match right there. Then there is a small percentage of time that we're seeing that the system is actually got a deeper knowledge base than the physicians, right? Which you might expect, right? AIs are able to actually understand very broad and very deep information. And so a fair amount of the time, the system is giving a diagnosis and a treatment plan, and the physicians are saying, this is just a little bit beyond my scope of practice here. And in those situations, we say, okay, it's time for somebody to go see a specialist.
And where does that come in the process? Is there something watching over the chat from 1,000 feet that says, okay, well, here's, big red flag, we need to call it off or start anew?
Yeah, so we're built on always testing, iterating. We keep all the data anonymous, but we do check and make sure that everything is operating appropriately. We do evaluations constantly to make sure that the accuracy is not only staying where it is, but improving over time. Yeah. And then, there's also a word out there that people often use called hallucinations, where an AI basically just makes something up, right? That is something that we can actually test for quite efficiently. We have a really robust system to do that. And Matt can talk a little bit about that, but our hallucination levels are well below what is state of the art today.
Yeah, and kind of speaking to your point about something up above looking down, right? For sure we have that, right? We're a lot of AI companies call those guardrails, but for us they're particular and we're calling them guardians, right? And they watch the entire conversation, and they're dozens of them at all times. And they're looking for anything that might be running astray in order to say, like, look, you need to stop this conversation and call 911, or this is outside of our realm of expertise and you need to talk to a specialist. And so kind of the whole system is built around patient safety, because safety is what matters, right?
These hallucinations sound like when I'm using it for ChatGPT for a story and it gives me a quote that was just not. That's exactly right.
Yeah.
And we get around that in a number of ways, and we can measure for that. But one of the primary ways we do that is with this system where we're looking for consensus, right? We're looking for the multiple AI models and AI agents to agree on something. And if an AI is hallucinating, saying 1 + 1 is 3, and another one says 1 + 1 is 4, and they're both wrong, there's no consensus. So obviously, neither of them are correct. They're both thrown away. So we go for this consensus model, which really, really reduces hallucinations.
Why is the consensus especially important in this field that you're working in? Like, if it gave me, you have 30% chance of A, 30% chance of B, 30% chance of C, is that productive, or is that kind of a different thing from what is happening at Doctronic?
Yeah, no, so first of all, I think you make a really good point, which is, medicine is not necessarily designed for you to walk into a doctor's office and for them to be like, this is exactly what you have, this is exactly how I treat you. That's actually not how it works. It's supposed to be methodical, where you come in and we say, these are the possibilities, and this is how we're going to evaluate this to confirm those possibilities. And once we confirm that with laboratory tests or other mechanisms, then we're going to give you a treatment. And even then, we want to check back in and say, oh, is the treatment working, right? And so it does speak to the fact that if we are able to give a general differential diagnosis so that you can give the possibilities of what are wrong, and then the workup is methodical, then you'll get led to the correct diagnosis there. When it comes to hallucinations, it's a little bit different, right? Hallucinations are really way off the mark, right? You're just leading you completely astray. So that is quite important in a system like this.
Tell me about the business behind Doctronic. You said 10 million consultations, 50,000 weekly users. What is the kind of business model behind it, and how are you thinking about building a sustainable and financially solvent business with producing something that's actually giving good health advice?
First, we want to make sure that the AI is always free, right? That's kind of one of the fundamental tenets of what we're building here. And so we make money when you pay for a doctor's visit. So there's that, right? And so as more people use the system and more people use our doctors, we're going to obviously make more money. But we think that there's a very near future where we are helping people navigate the healthcare system, right? The healthcare system is very complex, and being able to be that central part of the wheel, or that initial spot where people come in when they have healthcare questions, and we help them understand what's going on, and we send them off to doctors or our doctors, and we help them with labs, or we're importing all of their wearable data and helping them better understand their health, and kind of managing that journey through the healthcare system. That's the future, and that's essentially where Doctronic becomes this very big, very profitable company that's really helping people.
First of all, we're already seeing that from people using the system. They're coming to see our doctors and saying, okay, I now need to see a rheumatologist. Can you help me find a rheumatologist, right? Or I now need to get these labs, and then I want to come back and see you after I get those labs. And that actually is one of the most challenging parts of healthcare for a lot of people, right? Like, you go see a doctor, they say, go get some labs, and you say, how do I do this? Where do I find the labs? Or how do I find the specialist, right? That's something that AI can do incredibly well, right? We can actually automate a large portion of that and make your life a lot easier. It's just all about improving access, right? And access doesn't stop when you see that first doctor. It's got to continue throughout the entire process.
And it sounds like the idea in the future is making this more integrated throughout the entire health ecosystem. So what do you kind of see as the next evolution of Doctronic? Where do you want this to be in 5 years?
It really should be this point of first contact, right? Where you don't have to think about, how do I find this specialist, or how do I find this doctor? You just go to Doctronic and you say, this is what's going on. I need help with this. Help me navigate the system. That involves getting information that is immediate, right? And then that involves finding doctors. That involves getting all the diagnostics that you need. It involves follow-up. And then beyond that, the AI can do things that doctors could never do, which is check in on you a day later and see how are things going, right? Update your treatment plan through your doctor if things aren't going well. That's where we see Doctronic.
It's anyone anywhere, anytime, right? It's instant, it's an app, it's text messaging Doctronic, it's having a phone call with it, right? With AI voices, it's wherever you are, any language, and it's just helping you understand what's going on. And as Adam spoke to, it's also being really proactive, right? Hey, you need this prescription to be refilled, and really you should be doing this. And I'm watching your Apple Watch if you give me permission to do so, and you need to do this, and kind of understanding how to help you move efficiently through the healthcare system and benefit the most from it, right?
I know you recently closed a round of funding. How does that fit into the larger plans for Doctronic moving forward?
Yeah, I mean, this is a big problem, right? And so it's going to require a lot of resources. This is just the first step for us, and the funding makes us able to sort of push faster, reach more people, allow more access for more people.
Yeah, I mean, we're a seed stage company, right? So Union Square Ventures and Tusk Ventures came in, and so now we are hiring engineers, and we are hiring more doctors, and we are kind of building out the product and enhancing the systems, and building more safety guardrails and such. And as we grow, we have a pretty big plan for what we want to build, and we have to kind of attack those in small pieces, right?
What does your workforce look like? And are you hiring both doctors and engineers? Are you
Yes.
hiring people who have like touchstones with both of these occupations? Because I could see we
just
have a businessman and a doctor here.
It's just an army of AI bots in the background. That's all it is right there. No, it's the same thing as a lot of tech companies and healthcare companies that are combined, right? We need doctors, we need healthcare providers, we need practice coordinators, but we also need engineers because we're a tech-focused company as well.
Thankfully, a couple of our engineers have medical backgrounds as well. There happens to be a pretty big interaction there, or intersection there between engineers and doctors. There always has been. So it's mostly a team of engineers and doctors and a couple of people in marketing.
And you're thinking about basing the company here in New York, is that correct?
Yes.
Headquartered in New York, yeah.
Thinking a little bit more broadly, you mentioned before that I think in New York you said it takes 3 weeks to see.
3 weeks on average to see a primary care physician.
I'm not sure if you have similar numbers for non-urban areas, but like what is Doctronic doing to make healthcare more accessible, more equitable, not just digitally, but socioeconomically?
Yeah, and just to juxtapose that number right there, you can actually go right now, if you have a healthcare need, to Doctronic and see one of our providers in under 30 minutes. In actuality, the median time it takes to see a doctor is about 15 minutes once you complete an AI consultation.
And that's 24/7, by the way. So you could be 3 a.m. in Alaska and you can talk to a doctor.
24/7, all 50 states.
All 50 states, yeah. Right. So immediately you can see that access is being significantly improved there, right? But there are definitely portions of the United States that access is a lot more challenging, right? We have people writing in all the time from rural areas saying, like, the nearest doctor is 2 hours away. Can I use you as a primary care alternative, right? And so there are a huge amount of Americans out there that don't have primary care doctors, and there are a huge amount of Americans out there that are probably an hour or two away from the nearest doctor, right? And so this is really important for them as well.
Yeah, and we're charging $40 for a visit, right? And so we're pricing this to be affordable, right? We're not trying to build a system that is just another one of these systems where wealthy people get better healthcare.
Leads me to my next question. What else exists out there in the space, and how is Doctronic differentiating itself from the competition?
There's obviously a lot of AI systems out there, right? And to start with those, right, you know, the ChatGPTs, the Claudes out there, Doctronic is different fundamentally first in that it's built on a bedrock of the latest and greatest medical knowledge. It's continuously being improved. We're a privacy-first company, right? It's anonymous by default, but you can actually become a member and have a memory, which can be fully personalized to your health needs. And then the last thing that we do that I don't think anybody else out there does is that we are connected to a network of doctors in all 50 states, right? And so what you see there is like a sort of fully integrated system with the healthcare providers out there, which I don't think there's anybody else out there to my knowledge that does that.
For my own understanding, I could go and type my ailment into ChatGPT, but how would that be different from what Doctronics is giving you?
So ChatGPT is a generalized AI, and by the way, one of the many AIs behind the scenes in Doctronic is ChatGPT, right? But we have a lot of them, and ours are specialized, and ours are trained on the most up-to-date medical data, right? And there's a big differentiation there. And then our AIs will individually talk to each other and kind of discuss the patient behind the scenes, and they have this consensus model where they're built to make sure that we are accurate in what we're saying. And so all of these are strong differentiators from kind of the commonplace ChatGPT or Anthropic.
Yeah, but beyond that, like, you couldn't go see a doctor with your ChatGPT consult.
Lots of people are underserved by healthcare in this country. I'd say the majority of people. And it doesn't get solved by just giving people immediate access to more doctors. That's not even possible, but even if that were, right? It gets solved by helping all of the doctors that are practicing, like giving them better information, right? Again, this is the greatest chief resident, this is the greatest health assistant that you can have working to support the human doctors, right? Making their jobs easier and more efficient. And when you can do that, you can actually really raise the floor of healthcare. You can give everybody better healthcare. And that's incredibly important, right? We have a system that is failing a lot of people, and we're hoping to build a solution for that.
But not replace it. You're
absolutely not
augmenting
replace it, augmenting it, correct.
Not replacing it all, right. We're not designing the system to solve for a lot of the problems out there that doctors have. I think there's a lot of companies that do that already. We're really focused on patients and what their problems are. But in the end, it does free up doctors to spend more time doing what they really love, which is sort of practice the art of healing, right? They don't want to spend all their time charting. They don't want to spend all of their time writing notes. They want to be engaging with patients, right? And by using a system like this, that's what they can do.
When you talk to your colleagues, what is their reaction to this idea that you're building? Do they understand that this is something that is to augment and not replace? Is there like a general skepticism around it?
So I think AI is very interesting out there. Medicine has always been quite skeptical of new technologies, right? It's just part of our culture, right? We are skeptics by nature. And so it oftentimes takes a lot of time for technology to permeate the healthcare system. AI seems to be completely different. I think everybody recognizes out there that AI is just such a fundamentally different technology. It will have such a huge impact that actually most healthcare providers are sort of going towards it rather than running away from it. And I don't think it's not difficult for them to understand that this will be something that will be part of their practice going forward and that they need to embrace it, right? I think the vast majority of doctors out there are not worried that their jobs are going to be taken, right? They realize that that's not going to happen anytime soon. And
are there other applications of AI kind of happening in the background in your general work? Like how else is AI being utilized?
Yeah, AI is everywhere, right? So I like to break it up into two different parts. There's a predictive AI out there where an AI system is designed to actually predict whether somebody's going to get sicker or read a CT scan for a radiologist or determine if a cancer is dangerous or not, right? That's a sort of predictive AI. That's been out there for quite a long time, right? And there are a number of companies that are going after that. The generative AI component with LLMs is very new, right? It's new for everybody, and that really hasn't penetrated healthcare that much just because it's so new.
There's another interesting use case that we're seeing with users too. We have people that are writing in that are saying things like, an elderly couple where one person is kind of taking care of the failing health of the other, right? And they say, like, look, my husband's health is just too complex for me to manage, and your product is really helpful because it just constantly learns about my husband's health, and I can ask questions, and of course, anytime I need to, I can then talk to a doctor, and I don't have to wait, and I don't have to worry, and it's helpful in that regard, or parents managing children's health, et cetera. So, the system is not just being used for people who are looking for primary care for themselves or urgent care for themselves or that, right? It's also being used just to manage kind of the healthcare of loved ones. And it's really hard to do that. And there aren't a lot of resources for that nowadays. And so, we're building upon that as well.
It's almost the flip side of what I asked you about earlier, where people who aren't feeling comfortable bringing things to their doctor, but the benefit of having a real live person that you can talk to is that they learn about you and you develop a relationship. And it's obviously not the same if you're typing into a chatbot, but it is gaining a knowledge base about things that hurt and things that feel good, like what works, what doesn't work.
That's right.
Yeah,
that's right.
And it quite frankly, it can just learn so much more about you than any doctor could. So in the long run, it's very challenging for a doctor to know everything about you, everything about your health record, right? But a system like this obviously can.
That is a wrap on today's episode of New York Next. We hope you enjoyed the conversation. If you liked what you heard, don't forget to hit that subscribe button on your favorite podcast platform so you never miss an episode. You can also catch us on the New York Post YouTube channel, and of course, be sure to follow us on social media for the latest updates and behind-the-scene content. We are on Instagram, TikTok, Facebook, and X. Join the conversation and let us know what you think.